Oh, you got it.
We grew up in the town.
There's one for the minister.
Without electricity. Okay. Let us be seated. Chairperson, Dr. Sibongiseni Dlomo, Premier of KwaZulu-Natal Province, Minister of Health, Dr. Motsoaledi, Dr. Phahla, Deputy Minister of Health, Deputy Ministers in the Executive of the Government of of South Africa, MECs of the Provincial Government of KwaZulu-Natal, mayors and councillors who are present with us, Mr. Michel Sidibe, the Executive Director of UNAID, Mr. Erasmus, the Country Representative of UNAIDS, Dr. Sarah Baba, the Country Director of the World Health Organization, amakhosi akhona la phakathi kwethu siyanibingelela, the leaders and members of civil society, people living with HIV who are wonderfully here with us today, our partners, global partners for that matter, from the United States, PEPFAR, CDC, Global Fund, as well as representatives of CIPLA, Ms. Steve Litseke, who works closely with me in SANEC, Dr. Gwen Ramaphosa, who has just been appointed the chairperson of the SANEC Trust, nani nonke enila umphakathi ngiyanibingelela egameni likahulumente weRepublic of South Africa. Ngiphinde nginibonge ukuthi nila nathi namhlanje. It is an honor for me to address you this morning on this World AIDS Day. I must say at the outset that this World AIDS Day is like no other World AIDS Day. It is a very special day indeed, as we have all seen and heard. We've heard our Minister of Health here speaking in a crusading manner as though he was an evangelist. And we thank him for being an evangelist for health. We thank him for being the one person who continues to be the guardian of our health in South Africa. And indeed, those who are living with AIDS have a lot to thank him for, because he, together with other colleagues, have led the charge to make sure that we get to where we are. And it is all due to the hard work that Minister Aaron Motsoaledi, assisted by Dr. Phahla, his deputy, have put into this whole effort. Now, his work is also recognized by other people around the world. He works in South Africa, spends a lot of time amongst our people and communities, but he also gets time to travel around the world, and when he does, other people do recognize the passion, the commitment, and the enthusiasm that he has, and he evangelizes also in other countries as he goes around. He has been reappointed the chairperson of the Stop TB Partnership by the World Health Assembly. Now, this is like the highest decision-making body. Now, we have a lot to be proud for, because in him, he not only leads our efforts here in the country on health, but he is also recognized to lead that effort globally. And this organization coordinates more than 1,400 organizations across the globe, and they've appointed our one and only Minister of Health, Aaron Motsoaledi, to continue to be the chairperson of the Stop TB Partnership. And we thank him for continuing to be the type of leader that he is. Since 1988, World AIDS Day has provided an opportunity for people across the globe to unite in the fight against HIV/AIDS. When I came this morning, I asked myself, why do we hold World AIDS Day? And I concluded that there are 4 reasons why we should continue having World AIDS Day. The first reason is to celebrate those who are living with HIV. We celebrate them because they've demonstrated their bravery, their courage, and commitment to live. And we saw it with Sibusiso here and Andrew. And we thank them for continuing to be alive. And Andrew will live beyond 70 years. We are sure about that. So on this day, we celebrate the lives of people around the globe who are living with HIV. The second reason is to evaluate the progress or lack thereof that we are making in fighting this pandemic. Fortunately, in South Africa, as many people have said, we've made tremendous progress. And we want to thank you, Michelle Sidibe, for having been the instigator, for having been the person who encouraged our Minister of Health to ensure that South Africa leads the charge on this, against this pandemic. And this day enables us to have that opportunity to evaluate. We have made a great deal of progress, but much more still needs to be done. It is also a day when we want to thank our partners, those who work with us, UNAIDS, the Global Fund, PEPFAR, the US government, and many others who are working with us as our partners in this fight against HIV. But fourthly, it is an opportunity and a platform for us to recommit ourselves to achieve the objective of an HIV-free generation. Those are the principal 4 reasons why we celebrate this day. Now, in celebrating this day, we are also showing support for those living with HIV. This fight, in many ways, has brought all of humanity together, This day is also being celebrated, it's also being observed in many other parts of the world. And we are fortunate here that there are people who travel from far and afield to come and celebrate this day with us. Some from the US, some from Geneva, and some from Europe to come to be with us, which shows that they are our supporters, they are our true partners. Let us give a round of applause to our partners globally for the work that we do. Now, this fight against HIV has done more to unite the world than to divide it. This devastating virus has reminded us of our common humanity and our common vulnerability as well. It has also awakened us to our collective strength as well as our shared future. Those who support us did not need to support us. They did not need to be our partners. But because we have a shared future with them, they have decided to lend support, to give us a great deal of support materially as well as in other ways. We know that HIV infects and affects indiscriminately, but it thrives on ignorance, it thrives on conditions of poverty, it thrives on stigma, and it's in situations of unequal gender relations. It also thrives on destructive behavior, the abuse of alcohol and drugs, and unsafe sex. That's what makes this virus to thrive. It is therefore up to all of us collectively, as well as individuals, to take responsibility of our own health and the health of those we love and the health of those that we also know. Our theme for this World AIDS Day is Rise, Act, and Protect. As a nation, we must rise to this challenge. We must rise because we have to be determined and committed, as well as confident that we can succeed. The many steps that we have taken as a nation to address this pandemic were taken because we had a firm belief that yes, we would succeed. Yes, we will become triumphant. And yes, we can make progress. As a people and as individuals, we must act to inform, we must also act to support and to encourage others. No action is too small, no contribution can ever be regarded as wasted. We must protect ourselves and those who are nearest to us. We must protect those amongst us who are vulnerable. We must combat stigma and create an environment in which all can feel comfortable enough to be tested and comfortable enough to get treatment. World AIDS Day serves as an important reminder that the epidemic is still with us and that we must do more to increase awareness and, more importantly, to eliminate prejudice. To achieve greater success in our intervention strategies, we must focus on at the local level, and we must focus on the tasks that need to be taken at that local level for prevention as well as for treatment. Today represents and presents us with an opportunity to recognize, to applaud, and to support the outstanding work of our country's NGO sector and the AIDS champion who work tirelessly to educate people about HIV and empower them to prevent and treat and to manage it. We just saw champions from the local area of Ugu here, and we applaud them and we thank them for the wonderful work that they continue to do. And we call on all of us in various parts of the country to make sure that we create an environment in which champions like these ladies who stood here are able to do work to protect our communities and to raise the level of awareness. Let's give a round of applause again to our champions. And because of the consistent work of civil society, because of the consistent work of our champions, today we speak with one voice and a single message that we can make HIV and AIDS history. This is what we are saying with one voice today. And I'm very pleased that our members of civil society are here today. Last year, they celebrated World AIDS Day outside this tent. And today, they are here with us in this tent. They are not longer toy-toying against World AIDS Day. They are toy-toying together with us for World AIDS Day, and we thank them. They are here with us. The Department of Health and the South African National AIDS Council, SANAC, are committed to the UNAIDS fast-track approach of using innovative approaches informed by local knowledge and data to reach more people with comprehensive HIV prevention and treatment services. To strengthen our national response, we have recently completed research on the impact as well as the cost of an extensive range of known interventions against HIV and TB. This research proposes an optimal package of services to reach the most important groups in controlling the two diseases, HIV and TB. It confirms that we are correct as a country in our effort to significantly scale up the responses on both HIV and TB. This means that we will need to invest much more substantially over the medium term, but that we will start to save money over the long term as our prevention efforts begin to bear fruit when fewer and fewer people require treatment. This research encourages us to redouble our efforts to ensure that by 2020, 90% of people living with HIV know their status, that 90% of them are on treatment, and that 90% of those on treatment have suppressed viral loads. In our response to HIV and TB, we are driven by hope and encouraged by progress. We have invested massively in life-saving antiretrovirals, making our HIV treatment program the biggest in the world. South Africans are now living longer, and fewer people are dying of AIDS and tuberculosis. We have significantly reduced mother-to-child transmission of HIV. And yes, we join you, Mr. Sidibe, in your hope that South Africa will one day and soon be declared like Cuba to have ended mother-to-child transmission of HIV. We are hoping that we will get there. In fact, we are not only hoping, we are determined that we will get there. I went to Cuba with a number of deputy ministers. Dr. Patla was also in the delegation, and we were deeply impressed by how a country like Cuba, a small island country, had finally eliminated mother-to-child transmission. And we sat there quietly one evening and said, this we can do too as South Africa, and we made a pact that we are going to achieve this. And this we will achieve as South Africans, that we should reduce and bring to an end mother-to-child transmission of HIV. We are intensifying our efforts to end TB, particularly among high-risk populations such as prison inmates, mine workers, and people living in communities near our mines. We are improving our program to control and treat multi-drug resistant tuberculosis and more effectively integrating our national TB response with our HIV response. Individually and collectively, we continue to inform, we continue to fight stigma, and we continue to promote healthy lifestyles. You heard how our minister here had said that we are now launching a special TV program or channel that will just be focusing on health matters. And it is on this channel that we will invite all South Africans to at least have a look, at least 2-3 times a week, to get some tips, some lessons on how to continue to live healthy lifestyles. Despite our successes, thank you, despite our many successes, and we can record many successes indeed, of how this government has made strides to tackle the scourge of HIV, and indeed also tackling the scourge of TB. Despite all this, we still face many challenges. The number of new HIV infections is still extremely high, particularly among young women and girls. Among young women and girls. And this is where last year I made a call. I made a call that all these sugar daddies must leave our children alone. All these sugar daddies, leave our children alone. Go to your age group. Don't go to vulnerable girls and women. And we also call on young women and girls, please leave these sugar daddies. They are dangerous. Leave them out of your life. This we say because we are told that up to 2,300 young girls, as Mr. Michel Sidibe said, are becoming infected per week. And this affects young girls of ages 15 and 24. On a weekly basis, 2,300 become infected. We cannot carry on like this. This has to come to an end. We've got to bring this figure down, and it must start with the adults. The sugar daddies must stop molesting our children. We therefore mount a highly visible national campaign to decrease new HIV infections, particularly in this group. We are going to mount such a campaign to raise the awareness of young girls about the danger of sugar daddies, the dangers of having unprotected sex. While we have programs to reduce new infections in this group, we need a highly visible, nationwide campaign to significantly reduce new infections amongst these young people. The SANAC women's and youth and men's sector must also work with the relevant government departments to develop a comprehensive approach to prevention that we can launch early next year. Through this campaign, we want to reduce new infections in this group by at least 30% over the next 3 years. To our community AIDS champions, those who are working hard, we urge you to work closely with our girl children. we would like you to focus your attention on these girl children. We look up to our girls to lead our country in the future, and we cannot allow a situation where they will be wasted along the way. We look up to women to build and to guide our prosperous nation. And if we do not stop this type of behavior, we will not have such women who will be able to lead our nation. Women like Albertina Sisulu, Lillian Goy, Helen Joseph, and many others. When a woman objects to sex with a male who does not use a condom, the woman is protecting herself as well as the man. If he cares about the woman's well-being, he will take care and use a condom. We urge all our young people to be patient, to respect your parents, to get an education, and to abstain. And if you do incline to participate in sexual activity, protect yourself and use a condom. And if we do this, we will be able to triumph. Programs that were started in this province, for this province has been leading and leading in many, many ways. The program like Zazi campaign, which seeks to empower young women, can promote self-confidence among the youth so that they can make positive choices. We must equip young people with the tools to resist peer pressure, to avoid teenage pregnancy, and to define their own values that will secure them a healthy and prosperous future. We must admit that there's quite a lot of peer pressure among young people, and we must raise the level of consciousness among young people about the dangers of peer pressure, because the pressure that they are put under is, if you are a young girl, you have not yet slept with a young man, then you are not as good as you ought to be or like others. And in some areas, if you have not had your first child by a particular age, then it means that you are not as good a woman as you should be. And the problem with that type of peer pressure is that it then introduces other actors into the mix, your sugar daddies and all of them. We need to spread the word about prevention, encouraging all sexually active South Africans to use condoms consistently. We all have a responsibility to encourage people to test for HIV and TB. We call upon men in particular to avail themselves in their millions for free HIV testing and counseling at our public health services. It is important to be tested. We encourage men to go to clinics and hospitals to do so. And we join His Majesty, King Goodwill Zwelithini, and our traditional leaders in encouraging men to undergo safe male circumcision. Even when you are circumcised, you should still use a condom to increase your protection and the protection of your partner as well. We need to ensure that all those who need treatment do receive treatment and that they remain on treatment as well. We shall not overcome this epidemic unless all of us accept that this is a collective responsibility. Now, this should be easy for us to do because those who don't even live in this country, who are not even a part of our population mix, have made it their responsibility to join us in this effort. People in Switzerland, people in the United States, people in many other countries have decided to join us and become our partners. Now, it should not be difficult for us as South Africans to accept responsibility for the safety, the protection of those who are near us. We have a responsibility as a government and its employees, as every sector of civil society, as communities, as religious institutions, as youth groups, and as well as sports and music idols. All of us have a responsibility. In our personal lives, in our own behavior, we also have a responsibility. We have a responsibility as parents, as spouses, as partners, as girlfriends and boyfriends, mentors and role models. We have a responsibility to ourselves. And we also have a responsibility to others. As we commemorate World AIDS Day, let us work harder in all our communities and with determination to secure an AIDS-free South Africa and an AIDS-free world. This is the time for all of us to rise. This is the time for all of us to act, and this is the time for all of us to protect. It is the time, yes, to rise against HIV. It is the time, yes, to act against the spreading of more infections. It is the time, yes, to protect those who are near us. Masisukumeni sonke, sakhane, sisebenze ngokuqiniseka ukuthi lesifo sisehlise ngempela. Now, umsebenzi owenza uhulumeni mkhulu kakhulu lapha eSouth Africa. Uhulumeni usebenzile impela, no Premier wethu simzwile echaza ukuthi la eKZN kwenzwani na. Into engifana ukuthi nginqome abantu balapha eKZN ngayo ile campaign, iproject enayiqala isukuma sakhe. Siyanqoma kakhulu. Futhi siphinde sinibonge ukuthi you conceptualize isukuma sakhe campaign, and leyo campaign manje sesiyayithatha siyisa kwamanye ama-province. Amanye ama-province alandela i-example ebekwe yini bala eKZN. Siyanibonga impela ukuthi niyahola, nihambela ngaphambili. Siyakubonga konke lokho. Masikhuluma nalamanye ama-province sithi masambeni siye KZN. Masambeni siyobona kahle ukuthi bayenzani na. I am going to be leading the premiers of our country to come to KZN so that we can go on the ground, so that everyone can go and see how Sukuma Sake is actually working, because it is working. I want to therefore end by saying thank you very much, Premier Senzo Mchunu. Thank you very much, Minister MEC Health Tulapa, for all the work that you continue to do. We take our lead from what you are doing. And thank you very much as well for managing the various partnerships that you have built with a number of global organizations. We thank you. KZN leads, and the others will follow, and they will learn from you as KZN. Thank you very much.
A round of applause as our Deputy President is going to take his seat.